Hi guys, welcome to this Chegg Tutorials video. My name is Niyati and I'm a tutor here on Chegg Tutors. And today I'm going to be talking a little bit about Lyme disease. Lyme disease is actually a really big topic, but since I want to make this video within the time limit, I'm going to try to just give you the basic kind of outline of Lyme disease and just kind of a quick overview of it in a nutshell. So first, let's start with what is Lyme disease. So Lyme disease is basically a tick-borne disease, which is caused by a bacteria called Borrelia, burgdorferi. Borrelia is a genus, and this type of bacteria is a spirochete, and meaning it's a bacteria that's spiral in shape. And the way this disease is transmitted is by the bite of a tick called the deer tick. So the genus is called Ixodes, or I'm not sure exactly how you pronounce that, but I've written it right here, Ixodes. So an infected deer tick bite can transmit this disease, Lyme disease. Um, Within the context of the US, this disease is mostly found in the Northeast and in the Midwest. So some of the states where this disease is very common is states like New Hampshire, New York, Connecticut, Delaware, Maryland, Maine. So mainly like the Northeast states. In fact, Lyme disease was named after a town in Connecticut called Lyme, Connecticut, where it was first discovered. So one important thing about this disease is that it's often associated with camping and hiking in the woods in these parts of the country. So that's because that's when people tend to get bitten by the tick most often. So over here, I've put a picture of the tick here. So this is the deer tick. So moving on to the clinical manifestations of Lyme disease. So one of the most characteristic features of this disease is the target-shaped rash that develops at the site of the bite. This takes about a week or two to develop, and has a very characteristic shape in which there's erythema in the center and then pale around the edges and then erythema. So it looks like, I've put a picture of it here so you can see that this part is red and then it's pale and then it's red again. So it's a characteristic target-shaped lesion that's called EM or erythema, erythema migrans. Uh, so uh, Along with this, patients often can have non-specific viral-like symptoms where they have fatigue or generalized body ache or myalgia, which is muscle pains, or headache or neck stiffness. So these are some of the early localized signs of Lyme disease. So not all people generally remember the tick bite. A lot of the times people don't know that they've been bitten by a tick or don't remember that they've been bitten by a tick. But just taking a good history can help you diagnose it. So I'm going to get to that in the next slide. But coming back to the clinical manifestations, some things that can present later on, late-term manifestations of Lyme disease include carditis or AV blocks. So there's conduction blocks in the conducting system of the heart, which can lead to heart block in case of Lyme disease if there's cardiac involvement. It can also lead to seventh nerve palsy or facial nerve palsy. And there can also be joint involvement causing arthralgias and pain and swelling in the joints. So these are some later complications or some later manifestations of Lyme disease. So going on to the diagnosis, so you have to take a good history, and based on the history, certain things you're going to look for is, first of all, if you have a person that lives in an endemic area, like I said, within the US, if you're talking about within the US, you're going to look for a history of someone who lives in the Northeast or in the Midwest, someone who has maybe a history of going camping or hiking in the woods recently. A lot of these cases are seen around the months of March, April, May time. So the time of year can also give you a clue. And then, of course, you're going to look for the clinical symptoms, like I said, some of the viral prodrome kind of symptoms where you have fatigue, headache, myalgias, and also the rash. If you see the rash, then that is enough to start treatment. The characteristic target-shaped rash, along with this history, it pretty much tells you that this is you can almost be sure that this is Lyme disease. If you have the rash along with this history and other supporting evidence, you can start treatment. So some of the other ways that you can diagnose Lyme disease are by things like ELISA, PCR, which is polymerase chain reaction, for the particular Borrelia burgdorferi. You can use Western blot or IgM to detect antibodies against it. So once you've diagnosed Lyme disease, how are you going to treat it? So for the earlier, less complicated, less severe manifestations of Lyme disease, you're going to basically use oral antibiotics, mainly doxycycline, amoxicillin, or cefuroxime, for about 2 weeks. Now, when you have more severe presentations of Lyme disease, when you have cardiac involvement, or if you have central nervous system involvement like meningitis, in that case, you're going to use intravenous antibiotics, preferably IV ceftriaxone in those cases. I'd also want to add a little bit of a note about prevention of Lyme disease. So a few ways to prevent it is if you live in an endemic area and if you're going camping, one thing is you want to cover up your body against being bitten by a deer tick, and you should trying to wear light clothing is going to help for you to see the tick on the clothing, so that could be one method. Also using tick repellent sprays is another way that you can prevent Lyme disease by using the sprays that keep the ticks away. So that basically covers Lyme disease, what it is, how it spreads, the clinical manifestations of it, certain late manifestations and complications of it, and basic antibiotics that we use to treat it, and of course diagnosis. So I hope this video helped. I hope you enjoyed watching this video. The link to my Chegg Tutor profile is down below. If you have any questions, feel free to ask me on there. Thanks so much for watching, and have a great rest of the day. Bye!